Dr. Lori Travers discusses the incredible, safe technology used at Travers Lasik Vision Care.
So is LASIK safe, or how safe is LASIK? I had my eyes treated about 8 years ago, and I thought at that time the technology was wonderful. Clearly, that's why I had the surgery done. But it has made some improvements over the past 8 years, where it's gotten just a little bit safer and a little bit better, mainly for people with harder prescriptions to treat. That's where some of the technology is really helpful. But two of the areas where the safety has come into play, one of them is how we create the flap. We now use a laser to create the flap. For many years, I used what was called a microkeratome, which was a metallic device that worked very well, but it was based on using a blade to create the flap. Now we use what's called a femtosecond laser to create the flap, and it's given a layer of safety to creating the flap. It's actually been approved by the U.S. military for pilots. It's been approved by NASA for astronauts as well. So the safety of creating the flap has come a long way. Secondly now, the lasers themselves. They've fine-tuned the lasers. They've incorporated some wavefront technology that has really improved some of the outcomes. I think for most prescriptions, the technology has been very good all along. There was a large study done that came out in one of my big journals in November of last year out of the University of Oregon that statistically tried to analyze the risk of vision loss with doing the LASIK eye surgery versus folks who wore contact lenses and slept in them, and versus daily wear contact lens wearers. And the study showed that LASIK was actually safer than sleeping in your contact lenses. And then depending on how they weighted the data, it was about the same safety as daily wear contact lenses. What people don't realize is the risk of infection is much higher with contact lens wear, particularly if you sleep in your contacts, which is much more likely to result in a visual loss. So there's nothing that comes in life without risk, and there are risks with surgery, but the risks are very small, extremely small, of something affecting the vision long term. And the counter side or option of wearing the contact lenses is not without risk either.